Can a single injection actually help you lose weight? Wegovy and Ozempic, the names you've seen all over TikTok, news, and maybe even your doctor's office, are changing how we treat obesity and type 2 diabetes. But how do they really work? Let's break it down, scientifically. Wegovy and Ozempic both contain Semaglutide, a GLP-1 receptor agonist. Originally designed to treat type 2 diabetes, they're now being prescribed for weight loss, and with impressive results. So, what does semaglutide do in your body? It mimics a natural hormone called GLP-1, that's glucagon-like peptide 1. This hormone sends signals to your brain saying, you're full, stop eating, and slow down digestion. But there's a twist. Semaglutide stays longer in your system than natural GLP-1, meaning you feel fuller for longer and eat less without realizing it. It also slows gastric emptying, which means food stays in your stomach longer, making you feel satisfied for hours. That leads to fewer cravings and calorie intake reduction. Now the results. In clinical trials, people using Wegovy lost up to 15% of their body weight. That's huge, not just for looks, but for health risks like heart disease and diabetes. Of course, like all drugs, there are side effects: nausea, vomiting, diarrhea, and pancreatitis in rare cases. So it's definitely not for everyone, especially, pregnant women or folks with thyroid issues. When you combine semaglutide with diet and exercise, it actually shows even better results. But honestly, even without making major lifestyle changes, it still leads to pretty consistent fat loss. It's kind of gone viral. Celebrities, influencers, and even some tech CEOs have openly admitted to using Ozempic. But doctors really want to stress, this isn't a quick fix or just a cosmetic shortcut. It's a prescription drug meant for medical use. So, Wegovy and Ozempic don't just melt fat. They actually reprogram your hunger signals, help regulate your blood sugar, and support real metabolic change. It's where science meets weight loss, safely and with solid clinical evidence. If you found this video helpful, go ahead and give it a like. Share it with someone who's curious about semaglutide, and drop your questions in the comments. I'll be answering them. Thanks so much for watching.